Hello, everyone. Hi, I'm Payal Saxena. I'm a women's health specialist as well as a mental health advocate. And today we have Dr. Jayashree Dasgupta with us, who's a clinical psychologist as well as a faculty at Chitkara University. And she's working on a very interesting project, which is basically about caring for dementia across borders. Hello, Dr. Jayashree Dasgupta. So happy to have you here today.
Hello, Payal. Thank you so much for having me and really talking about this very important project.
So, Dr. Dasgupta, just to give you a little understanding of why I'm talking to you about this is I have worked a lot on spreading awareness about dementia. And to be honest, I got a huge support. Like, I got a support of somewhere around 20,000 people who came up with their stories as a caregiver and the problems that they faced as a caregiver and the challenges that they faced. And you're working on a very interesting project, which is basically on caregivers, caregiving for dementia patients across borders. So, can you tell us a little more about this project and how did you come about this idea?
So, yes, this is a very important project. It's very close to my heart because I've worked extensively with people who are living with dementia. And whilst I've been a therapist working with people who are living with dementia, I have to be very honest in the fact that a lot of the work I do is actually with the people who are caring for them. And this idea for this project actually came about from my own experiences where I realized that a lot of people in India are living with dementia, but their children are actually living abroad. And therefore, when they become dependent, when they start to fail in their cognitive capabilities, these are people who were incredibly independent. There's the ones who actually were aspirational for their children. They're the ones who encouraged them to, reach for the stars and go abroad, look for greener pastures, do something different and really tread that untrodden path. These are the people who've actually supported them in that entire process. And now these very individuals, because of dementia, can no longer be those independent persons that they used to be. And the challenge is when we don't have enough support services in India, how are these people cared for? So repeatedly, I would hear these stories from the families saying that they're struggling with care. And that's how this project really took shape.
So, Dr. Jayashree, till now, I know it's an ongoing project and there's still a lot to be done, but could you tell us a little about what have been your findings till now? Like, how are these children managing when they're living so far away? And I'm sure it's not easy for someone to just fly down immediately to India.
Absolutely.
There are visa issues and, they have jobs and everything. Right. So, what have been your findings or, let's say, challenges in terms of how this caregiving is going forward?
So let me just briefly tell you a bit about the project. So I'm an Atlantic Fellow for Equity in Brain Health at the Global Brain Health Institute, which is really a fantastic institute that's training leaders to look at issues of brain health and particularly dementia. And this project was supported by the Alzheimer's Association International, Alzheimer's Society UK, and the Global Brain Health Institute. And through this project, I've been speaking with families who are, as we've been talking about, facing challenges with providing dementia care across international borders. Now, obviously, initially, actually we've come across ways in which they've been incredibly innovative in terms of how they've tried to provide care. One of the things that's really emerging is that they are very heavily dependent upon technology. So communication using WhatsApp, using phones where possible is a mainstay. That's how they're really keeping check on what is being done in the household. So use of technology, and this is just one example, is something that they're very heavily dependent upon. The other thing which is also emerging is the support from the community. And that's also very, very interesting.
Absolutely. You know, you talk about community. In my entire life, I worked with community, both at the grassroots and the urban India. And I really feel that you can't do anything without community. And thank God for that. Like, thank God that in India, at least, we have a lot of community engagement. So, Dr. Jayashree, have you been able to talk about any of these community members and maybe figured out how are they able to, they're like, I feel that they're like a bridge between the caregiver and the patient. And they're able to kind of sort out problems at both ends, like maybe there they're able to tell them that no, it's all okay, it's under control. And here obviously they're able to take care firsthand of a patient. So have you been able to speak to any of these community members, and if you could talk just a little about it and maybe give a message out to India, so that they can focus more on community engagement?
Definitely, because one of the things that from the work that I've been doing in the rural communities and in the urban areas, I think there's one thing that I would definitely like to mention is that there isn't one solution for the dementia problem in India, because we have such a diverse society. We have to have many different solutions. And where we've seen that there is still a joint family system, people are able to manage better. Where the joint families have broken down, and we all know this, being Indian, that in the traditional joint family system, there was a lot of role, there were roles that every family member had. Where that joint family system has broken down now, people have been beginning to struggle. And in some cases, and I have to say this is not in many cases, but it's a story of inspiration, that in some cases the community has actually stepped in to bridge that gap as almost like a surrogate family. So it could be a well-meaning neighbor who's actually the one who checks in on the family every day and reports to the to the family, the children who are living abroad. They're the ones who are actually communicating with them on a regular basis and providing updates on their health, because the parent who's living with dementia is no longer able to do so. So that's just one very small example. But I do think it's important for us to start thinking of how we can organize communities better so that they can step in to bridge this gap. There are organizations also which are coming in to plug some of these needs, and they are going to play a much more critical role going forwards.
Absolutely. So, Dr. Jayashree, I know this is an ongoing project and you still have a lot of work to do. So, we'll keep having more sessions with you and keep understanding this a little more, as you move forward. In the end, I would just like to ask you if you could just give a message out to families here, maybe to the kids, or to generally the patients as well. If whoever is listening, if they can get even one piece of information from you that could be helpful, that would be great.
I think if there's one message that I want to give, and it's about the importance of timely detection. Unfortunately, there's very little awareness about the difference between the natural signs of aging and early signs of dementia. It has changed over the years. We do recognize that dementia is an illness. It's not just a person who's acting up. But memory loss and forgetting isn't the only symptom. It could just be a change in the person's behavior. And particularly for families who are living, and we use the term transnational families, because it's a family that's transcending international borders. If you're a child who has parents in India, I think it's really important to actually, make that video call, check in on health and well-being. But also check in with another neighbor or a close friend to see if they're noticing any changes in behavior. And don't be embarrassed about asking this question, because too many times we've seen that dementia is picked up when a person reaches a more moderate or advanced stage.
Yeah, absolutely.
And the earlier you catch any problem, the more you can do to get things in place to help that person. So I think if there's one message, it would be, don't shy away from asking the difficult questions about brain health, about whether they're finding any difficulties in managing their day-to-day behaviors, because as we all know, parents don't like to feel that they're a burden on the children. So this question has to come from the children. And it's really a part of, we believe in a sense of duty as Indians.
Yeah,
So it's
yeah.
part of that duty. Ask those questions. Timely detection is really important.
That's absolutely wonderful, Dr. Jayashree. Thank you so much for talking about such an emotional topic. I guess it's a very emotional topic. I can say that from personal experience. So thank you so much for talking about such an emotional yet a very important topic. And I know that the numbers are increasing, very unfortunately so, but they are. So thank you so much for throwing light on this, working on this project, and contributing to the development of India, I guess. So thank you so much for being here, and we'll keep meeting, and we'll keep getting to know. We'll get to know a lot about this. So thank you so much for being here, and we'll see you soon.
It's my
Thank you,
pleasure.
everyone. This is Payal Saxena signing off. Thank you.